Good morning, everyone. This video will help you to know about ventral septal defect. I am Saranya, Assistant Professor at Triplum College of Nursing. This video will explain you about the definition of ventral septal defect, incidence, causes, types, pathophysiology, clinical features, diagnostic evaluation, management, complications, and the nursing diagnosis of ventral septal. So, as an introduction, any acyanotic heart disease is a heart defect that affects the normal flow of blood. Example, if there is a hole in the heart wall, that condition may present at the birth. It may sometimes show symptoms or problems in later life. Sometimes it will resolve on its own. One such condition is ventral defect. That is, it is an abnormal communication between the right and the left ventricle, or else a hole in the heart which is present at birth. So the hole is present at the lower heart chambers, that is, right and the left ventricle. What happens because of this hole is it allows the oxygen rich blood to move back to the lungs instead of being pumped to the rest of the body. So the incidence of this is 42 of every 10,000 babies are born with ventral septal defect. It means 16,800 babies are born each year in the United States with a ventral septal defect. So 20% of congenital cardiac heart diseases constitute ventral septal defect. Next, causes. Genetic causes: improper development of heart during pregnancy, improper muscular development leaving the hole between the ventricles, baby with Down syndrome. So these are the causes which will constitute the ventral septal. So types, there are four types: membranous, subpulmonic, atrioventricular and muscular. So the first one is membranous. It will is beneath the aortic valve. It is membranous is beneath the aortic valve. Next, subpulmonic valve. You can see in the picture. It is beneath the pulmonic valve. Subpulmonic is it is the beneath the pulmonic valve. Next, atrioventricular is posterior VST. It is the posterior VST. And next is the muscular is it is a multiple. There will be multiple small VSTs. So these are the four types: membranous, subpulmonic, atrioventricular and muscular. Coming to the pathophysiology, so the ventral septal defects, that is the abnormal opening, it happens during the pregnancy, forms between the two ventricles. So it leaves a hole, that is a congenital heart defect which is present. In some cases, it may resolve on its own, but if it's not resolving, it creates the shunt between the right and the left ventricles. So the amount of blood shunted and the direction of the shunter is changed. So the hemodynamic significance of the VST, that is, according to the size and location, it varies. So increased pulmonary vascular resistance. So because of the VST, you can see the increased pulmonary vascular resistance. Then obviously you will have a right ventricle hypertrophy. So what are the clinical features is, first one is poor eating, slow or no physical growth, that is failure to thrive, fast breathing, tires easily when eating or playing, not gaining weight, breathlessness when eating or crying, shortness of breath. These are the clinical features of ventricular septal defect. Diagnostic evaluation. So on the cardiac examination, you can see a systolic murmur, mild to lower left sternal border, and regurgitation. You can see a regurgitation, that is the diastolic low crumble sound. So these two various sounds you can hear in the cardiac examination. Coming to the ECG, normal with right ventricular hypertrophy. Chest radiograph, the heart size and the pulmonary vascular markings are increased. Coming to the echocardiogram, 2D echo determines the size and the location of the VST. Coming to the management, medical management, 5 to 10% of VST closes spontaneously during the first 2 years of life. So, infant with ventricular septal defect, to prevent endocarditis, you give the antibiotics. Infants with ventricular septal defect showing signs of congestive cardiac failure are managed with digoxin and diuretics, that is the inotropes. You give the digoxin and the diuretics, that is the loop diuretics or the potassium sparing diuretics according to the need of the child. Coming to the surgical management, here you have a VST device coil closure. This is done through the cardiac catheterization. So it is just a coil closure. It is done through the cardiac catheterization. Next, coming to the VST closure, that is using the Dacron patch closure, which is done to a median sternotomy, that is open heart surgery, is being done. So during this procedures, you give antibiotics as prophylaxis. Nursing management, that is monitoring of vital signs, oxygen saturation, constant monitoring of heart rate and rhythm via telemetry monitoring is essential. And frequent assessment and monitoring for symptoms is also indicated. All patients with heart failure require daily weight monitoring. So these are the important nursing management that has to be carried out with the patients with ventricular septal defect. Complications. The child with ventricular septal defect can lead to a heart failure and Esmanger's syndrome, that is, unrepaired hole in the heart can lead to this complication of many years. Yes, that is endocarditis and other heart problems. So these are the complications of ventricular septal. Coming to the nursing diagnosis, decreased cardiac output related to the cardiac malformation, impaired gas exchange, activity intolerance, delayed growth and development, imbalanced nutritional status, and risk for infection. These are the important things. Yes. Decreased cardiac output, impaired gas exchange, activity intolerance, delayed growth and development, imbalanced nutrition, less than body requirements, and risk for infection. So a VST changes how blood flows through the heart and the lungs. Oxygen-rich blood pumped back to the lung instead out of to the body. So the oxygen-rich blood mixes with the oxygen-poor blood. These changes may increase the pressure in the lungs and require the heart to work harder to pump out. Because of this, the right ventricular is hypertrophy is being seen. So this is the major change which is happening in the heart, which can be resolved on the management, medical as well as the surgical management. And this is the references. So thank you. I conclude this video. I hope you people would have understood about the ventricular septal defect. Thank you.